Yogita Limaye, thank you so much for being part of this panel, especially taking time out during these very crucial and busy times for you there in Delhi. Can you just bring us up to speed? A lot of people have been seeing your reporting, and again, we salute you for everything you're doing there, bringing your skills to the story and empathy. What is the latest from the ground there in Delhi at the moment concerning the crisis?
Well, the situation actually still remains extremely grim. We haven't really seen improvement on the ground in the past 10 days since we've been sort of outside hospitals and crematoriums covering it. What you're still seeing every day is people struggling to find oxygen, hospital beds, struggling for ICU beds. So, when I wake up every morning, my messages are flooded with people asking for help. When you open Twitter, I'm sure everyone is seeing that. And, even on the streets, I've actually been seeing people who've just brought their family members in the back of their cars, in the back of auto rickshaws sometimes literally hunting around, going from place to place to get any kind of medical attention. And sadly, in front of us, we've seen in the past week, people sort of collapsing during that hunt, not even being able to, they're not even, there's not a chance even for them to be saved. So yeah, people are dying of COVID-19 in India, but a lot of people are dying because they're not getting the medical help they need on time.
Yeah. Now, we saw you reporting about all of the foreign aid coming in as well, but Daryl, I'm almost afraid to ask this question, but is it going to get quite a bit worse before it gets better?
What we saw in India, even during the first wave, was that different regions of the country peaked at different times. I've had a lot of people ask me, is the worst over in Delhi? It's really hard to say because, it's not, at this point, as I said, it's not just about how the virus is spreading and people getting severely sick from it. It is people who could be saved, who are dying because of a shortage of medical care. And so it's really kind of hard, I think, even for epidemiologists, even for doctors, to put their sort of finger on when are we going to start seeing the number of deaths fall. And what we're currently seeing in India is very worrying surges from many other parts of the country. So Uttar Pradesh, which is one of the most, well, it is the most populous state of the country. We're seeing a really worrying surge in cases in many areas of that state, from the state of West Bengal, where you had election campaigns going on till just about a week ago. Again, we're seeing really sharp spikes in COVID-19 cases and deaths from there. So I think what is very clear for everyone who's working on the ground here is that this isn't ending soon. There's going to be weeks, maybe possibly even months of difficulties ahead.
Sure. And as we saw when the United States was the hot spot, I mean, people can add a lot of inputs, oxygen, beds, these sort of things. But if you don't have the skilled bodies there to treat these patients, it doesn't make that bit of a difference. So it leads me to the question, with all of this foreign aid coming, does India have, or Delhi specifically, the absorptive capacity to take this and actually deploy it sensibly and in an effective manner?
Well, I think what needs to be done right now, it needs to be done on war footing. What we're seeing unfolding in front of us is a disaster, and it needs to be treated like one. Yeah. So what we need to see happening on war footing is capacity being built up, field hospitals, somebody trying to assess where is the next peak going to happen, which part of the country is going to be badly hit, having field hospitals there with at least oxygen facilities, even if you can't immediately sort of put in an ICU there. But as you rightly pointed out, this is not just about equipment and supplies. I mean, those are extremely short as well right now. So, you have hospitals in this city and other parts of the country who are saying, we've got patients, they're going to die if we don't get oxygen supply. So those are extremely critical, but you need doctors and nurses. You can build up as many hospitals as you want, but if you don't have people with the right skill set, that's not going to help save lives either. So this needs to be an effort which is on war footing to build up new facilities, to identify the locations where you're going to need them in the coming weeks, but also, and I'm not exactly sure how the international community can help in this, but there is expertise. There are doctors, there are nurses all over the world. We see them fly in when you've got big disasters like earthquakes or cyclones, for example. And if we have that coming in, that will certainly help the situation on the ground.
Yeah, and I guess the timing is terrible in the sense that so many other jurisdictions are just in crisis mode as well. Even here in Canada, we don't have enough doctors and nurses. So um, I wanted to ask, as many people know, India is one of the biggest vaccine manufacturers in the world. And yet we're hearing reports of people actually on the ground there in India not being able to get vaccinated because there are localized shortages. What is the situation there, as you said?
Well, so, I've literally just booked an appointment to get a vaccine because it opens up for everybody over the age of 18 on the 1st of May. I have an appointment. I'm not 100% sure there will be a stock of vaccine available. I've been trying to book for my parents, for example, and there are shortages of supplies. It was always going to be a challenge, even if India is the world's biggest vaccine maker. Look at its population. It's 1.3 billion people, 2 doses each. That's more than, that's around 2.6, 2.7 billion doses of vaccine. Even if you say, not the whole population, but cover a significant chunk of it, that's still, we're talking about a mind-boggling number there. It was always going to be difficult, but I think there were a lot, precious time, over the past 3 months, could have been sort of saved to create more vaccine, because we've had producers in India, Serum Institute, which is the world's biggest producer of vaccine, mass producing the Oxford AstraZeneca vaccine, but also the Novavax vaccine. And they've been talking about a few things that are limiting their capacities. I mean, one, significantly, they talked about funding, and which now sort of in the past week, the government of India has said we're going to, give you $600 million to the 2 vaccine producers in India, who, the vaccines of which companies have been rolled out. But I think the question is, could that funding have been put in earlier to ramp up production capacities? Could Serum Institute, for example, have been producing more doses from February, from March onwards? The second thing, as they've been pointing out, is the raw material shortage. And again, now we've seen action from the US on that front this week when the situation became really bad in India. I guess the answer really is that, yes, many, many more people could have been vaccinated until now if a few of those things had been fixed.
Right. Now, the name of the panel is Vaccine Diplomacy and Vaccine Nationalism. India is up there pretty much on the level of China and Russia in terms of either donating vaccines to bilateral countries, friendly countries, or selling them. Might that have been an example in India's case of misplaced priorities? In other words, focus more resources on taking care of the problem at home, or as you say, trying to prevent the problem from spiraling out of control, rather than looking at these other countries and trying to help them. And I'll just throw in there that one government minister, I believe, said that, well, if we didn't help those other countries earlier, they may not have come and helped us right now. What's your take on the situation there?
Well, I think every country has to strike a balance to say, if anyone says that, oh, India should have kept all of the vaccines it's producing for itself and not given them overseas, I'm not sure that would have been, looked at as a very good move, partly because, the vaccine we're receiving in India, or the Oxford AstraZeneca one, for example, it was not developed in India. It was developed by Oxford and AstraZeneca. And, this is, it's basically global cooperation, which is helping even us in India get vaccinated at this moment. So, I think, I don't think it would have been a very wise thing for the Indian government to say, absolutely not, we're not sending vaccine anywhere else in the world. I do think that there needed to have been appropriate planning of how much vaccine India is going to need, according to the pace of vaccination that is possible in the country, to ensure that at least the supply of vaccine is able to keep pace with, how many people you can inoculate in a day, for example. Placing orders with companies. So I think while a lot of countries around the world were placing orders with different companies to procure vaccine stock, some of them excessively so, from what we've seen, much more than their needs are. But I think in India, even now, there is no clarity really of what kind of stock is there, what kind of orders have been placed, what negotiations are going on. Because the situation got so bad, India approved all of the vaccines that have been approved by the US FDA, for example, and some other regulatory authorities around the world. But that doesn't mean much unless those doses are actually coming into the country.
Right. Right. And on the foreign policy scene now, there was a lot of commentary as well about the Prime Minister spending a lot of time on foreign policy as the crisis was spiraling out of control, either foreign leaders coming to India or him traveling elsewhere. And you already talked about the rallies and stuff like that. But was that misplaced too? Should much more attention have been placed in recent weeks on domestic policy and preventing this from actually happening?
I think there was a sense in India, in January and February, when the daily new cases and deaths dropped dramatically, as we actually saw happen all over the world. Yes. When the first wave subsided, all over the world, you had those numbers drop, and then you had, in many parts of the world, a second, much more deadly wave. But in India, you had, for example, in February, the ruling BJP party actually pass a resolution saying that India had conquered the pandemic under the leadership of Prime Minister Narendra Modi. In March, when there were surges being reported from some districts in India, you had the country's health minister, Harshvardhan, say that the pandemic was in its end game in India. So I think there was a lot of, there was this premature sense of conquering something that was really unpredictable in the face of evidence from all over the world that there were, a second surge was almost inevitable. And in that situation, vaccination was only one part of it. I think it's about stocking up on all, the medicines needed, oxygen supplies needed. In some places, field hospitals, which were built up during the first wave, were dismantled. So I think being better prepared. And then, of course, the one crucial thing I think that the pandemic has taught all of us, that, how do you control the spread of COVID-19? And the basic things like, stopping mass gatherings, ensuring there is people follow COVID protocols. And that messaging really needs to come from the top to percolate in a country like India. I think last year, during the first wave, the messaging from both the national as well as sort of state leaders was very consistent about wearing masks, social distancing, not having big gatherings, people really being as careful as they can. And then that just all, seemed to slip away in February and March. And, now India finds itself in this situation.
And finally, should a lot of governments around the world have taken that early victory lap, declaring the pandemic over? But should other countries look at India as this could happen to us too? That if we don't take care of a third or possibly fourth wave, that the same thing could happen to us. So this is kind of an early, or yet another warning signal.
Well, yes, absolutely. It is yet another warning signal. I think the warning signals were there even for India from all over the world. This is something, as reporters covering India for a long time, we had thought might happen last year because of the situation of healthcare in this country, where there's been successive governments have never invested enough in healthcare in India. I think it's about less than 2% of the GDP. And if you look at the US in comparison, I think it's about 17% of the GDP. And this is not, it's not just this government, successive governments have done that. And therefore, knowing that situation, how fragile the healthcare systems are, what we're seeing happen now, it's almost sort of what we feared was going to happen last year. And I think last year, because the pandemic was new, because countries all around the world reacted with a lockdown, you also had sort of perhaps one of the most stringent lockdowns in the world in India. There were other repercussions of that lockdown, from the economic point of view. But there were a lot of reasons, including the virus itself and its mutations, that we didn't see sort of these scenes last year. So I think there was a lot of speculating, I remember, about people in South Asia having higher immunity levels, lots of speculation about why it might be affecting this region less. Even now, if you look at the death rate compared to the size of the population from official numbers, which we know are vastly underreported, even if you factor in all of that, it is still quite low compared to sort of countries around the world. But I think when you have the medical infrastructure collapsing, that sends your total number of deaths spiraling upwards. And so, yes, I think especially for developing countries around the world, I think it is definitely a warning sign that, this is the coronavirus pandemic is extremely unpredictable.
Okay, Yogita Limaye reporting from Delhi for BBC World on our Frontline panel on vaccine diplomacy. Thank you very, very much. Again, we salute your work and please take care of yourself.
Thank you so much. Thanks a lot.